Good evening and happy Doctors Day to all the participants. I would like to invite Dr. Bijoy E. He is the Joint Director of SHA to deliver the welcome speech.
Thank you, Latif. Good afternoon, all. I'm here to welcome you all on this Doctor's Day, which is observed to commemorate the birth and death anniversary of the former Chief Minister of West Bengal, Dr. B.C. Roy, who made an enormous contribution to the medical field. The COVID-19 pandemic has once again reminded us about the contributions and the sacrifices made by the healthcare workers around the globe. State Health Agency has been an integral part of Kerala's healthcare system for the past 1 year through these difficult times, and it is with the great pride that we organize the webinar today with the participation of our esteemed panelists from the WHO and the National Health Authority. First of all, I extend my wholehearted welcome to our own Executive Director, Dr. Ratan Kelkar, sir, who will be inaugurating this program. Welcome, sir.
Thank you.
It's our great pleasure to welcome the Director of National Health Authority, Dr. Pankaj Kumar Arora, who will be delivering the keynote address on the Doctor's Day. Welcome, sir.
Thank you.
We have two public health finance experts with us today from the WHO, and we are all eagerly waiting to hear from them about the quality of care in public health insurance scheme. Welcome, Dr. Grace Cabania and Dr. Jaydev Singh Anand. Welcome, sir. I also welcome all my team from SHA, from the district and state level, and all other esteemed dignitaries from across the state to the online learning experience of this webinar. And I wish the program all the success. Thank you. Thank you. Latif.
Thank you, sir. The program will be inaugurated by our Executive Director, Dr. Ratan Kelkar. So, sir, please inaugurate the event.
Good afternoon, everyone. At the outset, let me wish you all a very happy Doctor's Day. And on this day, it's extremely heartening to note that the SHA has organized a webinar for the benefit of everybody. And in this process, we would also like to thank the presence of NHA, Dr. Pankaj, and from the WHO, Dr. Grace and Dr. Jaydev, who are here with us today for delivering their talk. It's extremely heartening, especially for SHA, which has just completed a year and which is striving very hard to meet all the objectives and realize all the goals, and at the same time ensure that excellence is not compromised in all its activities. So for organizing a webinar like this at very short notice, it has been tremendous work for SHA, and I hope that the benefit of this webinar would be far and wide in our doctors community, and also would help in the delivery of citizen service to the best extent possible. So once again, wishing you all the very best, and wishing this webinar the very best. I heartily inaugurate this webinar, and over to you, Latif. Thank you.
Thank you, sir, and thank you for your good words. Indeed, on this Doctor's Day, we had a fantastic speakers panel. We will be having two presentations, and at the end, we will be having a 10 minutes discussion. I would like to invite Dr. Pankaj Kumar Arora, sir. He is a well-known surgeon. He did his MBBS and MS at, and he is now he's an officer in Indian Railway Health Service 2003 batch. He is a fellow and a counselor of American College of Surgeons. Currently, Dr. Arora sir is working in National Health Authority as a director. So I would like to invite Dr. Arora sir to share his views on this Doctor's Day. Over to you, sir.
Thank you, Latif, and thank you, Ratan sir and Dr. Bijoy for giving me this opportunity to put my views on this day, which is one of the days which doctors remember and celebrate. I'll go through, and I also welcome Grace and Jaydev ji to being my co-speakers for today. I'll just share my screen for the benefit of the people. Can you?
Sir, you have the right to share the screen.
Yeah, I'm not doing it. Yes. Okay. Yeah, I think you can now see my screen, everybody.
Yes, sir. Yes, sir.
Okay, so basically, what we are just today doing is giving a tribute to Dr. B.C. Roy. He was an eminent personality, and there are no words which can explain him and his contribution to this country and to the poorest of the poor who has served, especially in West Bengal, and also pan India people. The nearby people also uh, went to him for treatment, and a lot of people were educated by him. So today is his birth anniversary, and as Dr. Bijoy said, it was unfortunately the day where he died too. He was born in 1882, and at the age of 80 years, he passed away on the same day. He was a great physician and a great teacher. He taught a lot of students and gave a lot of teachers for the medical fraternity and a lot of doctors to serve further. I'll just tell a thing. I think you must be knowing, but still reiterate it. That Dr. B.C. Roy was a very patient and a persistent man in that way. He did his MBBS and applied for a postgraduate degree in St. Bartholomew's, UK, but was rejected being Asian. And he tried again and again to the limits of 30 times till he got into that university. And it is amazing and a rare feat that he got both the fellowship of Royal College of Surgeons as well as Royal College of Physicians. It's a rare thing. You can't get it. And now you can't get it at all. But he was that eminent that he got it, and he completed the course, which was 3 years and 2 years and 3 months. He was found suitable after that, and he could have stayed there and who should have had a very beautiful life in UK, but he decided to come back to India. He came back to his parent place and joined the Provisional Health Services immediately when he came here and served the people of West Bengal and India. As he joined Calcutta Medical College and other colleges down the line, and then taught a lot of teachers to students to become teachers in the time to come. When he was given the opportunity to become the second Chief Minister of West Bengal in 1948, he took it and served till the end, till 1962 when he was there as a Chief Minister, and did a lot of things, a lot of social work, founded Chitranjan Seva Sadan, Jadavpur TB and Kamala Nehru Hospital, and a lot of other things. We can't be put in one slide, and he has been that a visionary that the things cannot come in a slide. And for his contribution, he was given the highest honor, Bharat Ratna, in 1961. And today, as being a doctor myself, I think we should celebrate this day for him, as well as all the doctors who have contributed in our lives, and pay gratitude towards them. This COVID time, as Dr. Bijoy said, has made us realize more so about the doctor's contribution. Somebody was wanting me to write something in this slide that doctors contribute during COVID-19 pandemic, but I could not think about anything which could be written in this single slide or any number of slides which they have contributed to. Actually, they have done what is immense, what is risking their lives, not only their life, their family lives, staying away from them for 21 days to 1 month and not meeting the kids that thought their parent is gone, where he is actually, where she is. I was there in the COVID ward for 14 days, and then 7 days I was in isolation. I could not see my daughter, and she was calling me, doing a video call to me. But when I went home, she literally cried and hugged me like anything. So not only doctors, I can say any healthcare worker has contributed immensely, and we should celebrate this day for doctors as well as all of them who have contributed this on the line of duty in COVID-19 pandemic. It has been such a shock to all of us that this pandemic occurred, and we were taken aback, and the doctors were there to take us through those first and second wave against the flow of the cases which we had. We lost a lot of people, a lot of doctors too, and I think we should salute everybody who has lost his life fighting with us in this pandemic of COVID-19. And also we should thank the government who had come up with such a huge campaign of vaccination and provided the healthcare setup, which was, and builded it actually over the period of time during the period, which was very, very, very seriously bad for us. And then came the the thing which helped us a lot and a game changer, the COVID app actually, which gave us the opportunity to register ourselves, schedule our appointments, and get the certification also on the same app. And this is being jointly overlooked by the Ministry of Health and Family Welfare and the Ministry of in Electronics and Information Technology, and been looked after by the Committee of Empowered Rural Vaccine Administrator. And fortunately, we have the heading us also of the committee, the Dr. Shri Adarsh Sharma sir. He has been a man of ideas, and he has changed a lot in this country, being an administrator over a long period of time. And he also had an idea of about the people who were not able to have that app. They might not have a mobile phone actually, which is have as a smartphone actually, which has an app. So he thought of starting a dedicated call center, which is 1075 for our people who have a simple mobile phone. They can call at this number, they can get registered, they can get an appointment, and the scheduling can be done on the same call. So this is something which I think we should be telling everybody in this area, that they can, if they don't have a smartphone, they should call 1075 and they will be listened to. They will be told about the areas nearby. They will be given the appointment. They will be scheduled for the injection, vaccination, and finally will get a certification also. I'll also say Dr. Praveen Gedam sir and Dr. Vipul sir have been very kind and supportive, and have also been leading the program in this place. And this is the thing which, when the people were hit by COVID-19 and lost a lot of money to it, the ABPMJ came, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana came as a shield to them, and they were treated for all the diseases, including the COVID testing and vaccination. This scheme is an amazing scheme, I tell you. As a doctor, I'll tell you, this is something which I never thought will happen in India. But our Honorable Prime Minister and the Health Minister has delivered it actually. It's difficult to understand, to know that how difficult it is to cater to such a large population. And it is covering nearly 40% of the population of India. It is covering 10.7 crore families, 54 crore people, which are increasing over a period of time, including, they are included as per the SECC criteria of 2021 survey. And it covers 5 lakh rupees for the whole family, and the number and age are no, number and size, the age of the family are no cap to that. And there can be any number in the family which can be come under the umbrella of the scheme. And all the pre-existing disease from the day one are being treated actually. Insurance companies say 2 years it will not be done and all, but it covers everything from the day one. And adding to that, we have extensive coverage of EHCPs that are empaneled healthcare providers, which are spread over India in public and private sector. The state of Kerala has been very kind and helped us a lot to deal with that, and they have been very supportive, and they have served a lot of people through this scheme too. And otherwise also they have been doing the bit and they're helping the healthcare in that area. And now I'll just explain a bit about what thing they have done for COVID-19, this ABPMJ, how it helped. We have told the healthcare provider to get them tested and give them packages for COVID-19 treatment. So we have done 17 lakh plus tests, and 6 lakh plus people have been treated under the ABPMJ scheme. And it has really helped and proven to be a gatekeeper to ensure that the people who are poor, the people who have nothing to go with for the treatment, have no money in the pocket, get full treatment to the level that they have not to pay a single penny when they enter. They will get the food, and they will even be getting the medicine after discharge for 15 days. It is actually impossible to imagine that we could provide it, and I'm really happy to say this thing, that the Prime Minister had that vision, and the leadership of the Health Minister and the leadership of the NHA had the vision, and the state health authorities and agencies that helped us to deliver it to the last man standing in the line. And it is I'll just take this opportunity to say that NHA is working day and night to ensure that we give the treatment to all the people who are the beneficiaries. But I'll ask all the people who are there in the healthcare to uplift the vision of the scheme and become part and share this vision and do their bit. So and NHA and SHA will provide all support needed to them. They will handle at every point of time. They will give them training. They will give them the support which is required to deliver it to the PMJ beneficiaries. On this note, so I would like to propose that doctors should take a pledge that they will follow the path of Honorable Bharat Ratna Dr. B.C. Roy and create the best healthcare environment for all so that everyone could live healthy life physically, mentally, or socially. One more thing I like is that our WHO friends are there, so I'll ask them, which is, I think that is what I've been going through my mind. I have seen the my colleagues, my students, the resident who do not have can change the clothes in PPE and they have to wear a diaper some places PPE during serving this COVID time to help to open a healthcare, mental healthcare helpline and a dedicated website to provide support for mental health of the COVID fighters. And I think that will be the real contributor on this day to BC Roy, who lived for serving people. And we should now think about helping those doctors who are serving people in a way of creating this helpline. Thank you for giving me this opportunity to put my views and give a tribute to the Bharat Ratna Dr. B.C. Roy. Thanks a lot.
Thank you, sir.
Thank you, sir. Thank you, sir, your in-depth presentation. So the next presentation will be led by Dr. Grace Kabania and Jaydev Singh Anand. Dr. Grace Kabania is a health financing lead in WHO country office in India, where she is supporting the government's health financing reforms. Previously, she served as a regional advisor of health economics and financing in the regional office of WHO in Africa and the health economist in the WHO country office of Uganda. And we have another eminent guest, Mr. Jaydev Singh Anand. He is also work as a national professional officer in health financing at WHO country office India. He is also engaged with Access Health and GIZ Bangladesh team. I heartily welcome to this presentation. Over to you, Dr. Grace and Mr. Jaydev.
Thank you very much, Latif. It's an honor to share with you, colleagues, Shah Kerala, and your team. I wish you a happy Doctor's Day, and it was good to learn about Dr. Roy. I just wanted to congratulate you for the choice of topic on the quality of care in public health insurance schemes. Quality of care is one subject that is rarely discussed when we talk about UHC, but especially from the public health insurance scheme angle. And yet we think that the state health authorities as purchasers of care have great power and great decision-making space in influencing quality of care through different instruments that they use. I'm going to ask my colleague Jaydev to share a presentation we have made, and then afterwards we shall open up for questions and answers related to the topic we have presented. Over to you, Jaydev.
Thank you, Grace. And before starting off, I would firstly like to wish all the doctors on call and healthcare workers on call a very happy Dr. Day. Thank you for all your hard work and support through this unprecedented crisis, and we truly appreciate all of your contribution. I would also like to thank the State Health Agency of Kerala for inviting us to speak on the topic of quality of care in public health insurance schemes. So as Grace has already mentioned, this topic will primarily cover the issue of how public health insurance schemes can really promote quality of care within their system. So yes, thank you. So the first slide to start off with is, a lot of you may be familiar. Yes, sorry, you can leave it there. So a lot of you may already be familiar with, this framework of quality. And I think this is a gold standard that is used time and again, the Donner-Badian model. I don't mean to preach to the choir, but maybe a quick overview is that this model really sets out the standard of how one can assess quality of care. Now, this relates to three broad heads, which is really the structure, process, and outcome aspects of assessing quality of care. So when we talk about structure, we're really talking about what is the kind of input required to provide quality of care, the input of staff, of equipment, of supplies, the process involved in that, which is, how you go about treating or investigating a patient. And there are, of course, defined guidelines on what such processes should look like. And the final sort of pillar of assessing quality is outcome. Of course, the ultimate outcome measure is mortality, whether the patient lived or died. But of course, there are other measures such as morbidity and also patient satisfaction, which are very important indicators of quality of care. Next slide, please. So coming to PMJ, which is the public health insurance scheme of India. I mean, of course, every state has put in its own effort and innovation on in customizing the PMJ. Kerala has CASP and has certain processes and procedures that are way ahead of where you may find in some other places. But what PMJ really does is provide a very concrete blueprint on which the public health insurance system in India is defined. And PMJ has also in recent times, or in fact, since its inception, because even its inception is very recent, kept quality of care front and center in its operations. So as a lot of you may be aware, NHA did join hands with the Quality Council of India and set out a bronze, silver, and gold certification, not only for empaneled hospitals, but also for non-empaneled hospitals, which I'm certain will truly contribute to quality of care under the scheme. Next slide, please. Thank you. So it may be important to first, really think about whether does PMJ address all dimensions of quality as they are framed in the Donner-Behrden model. A review of the indicator suggests that yes, there's clear criteria for structure, a certain number of beds, a certain number of input equipment, whether it's staff or other such and so on. There's also a focus on processes where it really talks about how Arogya Mitras should be deployed, what kind of signage should be up, etc., all of that. But in terms of its approach to quality at an outcome level, there is definitely scope to further develop quality under PMJ. Now, that is not to say that PMJ does not consider the outcome pillar of quality at all, which is why you see a question mark and not a cross mark, because considerable efforts are being made at NHA to also look at quality of care at an outcomes level. But where scope for building further does really exist is that right now outcomes are incentivized through the scheme at an aggregate level. So of course, hospitals are given incentives if there is mortality that cannot be attributed to patient characteristics or Dharma and Lama, but it's also a matter of really looking at the individual outcome level at a very specific clinical level, wherein quality can be further improved, looking at specific clinical outcomes and indicators. The quality of care in terms of outcomes can also relate to, what the patient experiences. And while PMJ does, of course, have, output in terms of, or rather assesses quality in terms of patient satisfaction, in its current form, it can be fairly subjective. And there do exist measures such as, patient-reported outcome measures to assess health-related quality of life. And in several settings, these are actually used to make certain decisions about the level of quality that is provided by understanding from patients through structured questionnaires what was the functional improvement or what was the improvement in their mental well-being following this process. Finally, very often outcomes can be very difficult to measure, right? I mean, of course, there's the ultimate mortality outcome, but outcomes can also be complicated by a host of factors which are outside the control of any single physician. In which case, outputs are, of course, very important indicators of outcomes. So, for example, was a particular kind of medication prescribed, or was a specific kind of procedure done keeping in mind that individual patient's characteristics? All of these can truly contribute, when we look at quality from an outcomes pillar. But of course, it's easy for me to sit here and talk about what should be done and could be done. But maybe it's always more useful to see, what are the kind of measures or what are the ways in which, outcomes are guaranteed in other settings to improve quality of care. So next slide, please. Which brings us to the topic of strategic purchasing as a tool to improve QOC, quality of care. Now, strategic purchasing is essentially nothing more than knowing your population well and using the right kind of financial tools and incentives to promote quality of care. If we try to look at strategic purchasing in a very structured way, it essentially consists of four very important pillars. One is for the purchasers, such as the SHA across states, to decide what exactly it is that they want to buy. Now, NHA already provides, approximately 1,300 procedures that it's going to buy. But, the more specificity that can be brought into what exactly is the money paying for, the greater one can direct practice towards more quality practice. The second important pillar is the contracting. What are the terms and conditionalities involved? What are the contingencies that are attached, and what are the things that both parties, contracting parties, the purchaser and the provider, agree or disagree on in terms of talking about providing services. The third and possibly the most talked about one is the provider payment mechanism, which is the specific financial tool which will be used, or the amount of money that the provider would be reimbursed to provide service of a particular quality. Now, it's not to say that it's about cost containment. It's really about that financial tool should be able to encompass all of the factors that go into ensuring provision of quality care. And finally, accountability on part of both purchaser and providers to make sure that all the conditionalities that they agree upon as part of their contract, they are held responsible for. So it is assumed that within this framework of having clear contracts, having a clear definition of which services are to be provided and how they are to be paid for, quality of care can be ensured. Next slide, please. But having said that, these four pillars are, of course, important to strategic purchasing, but there are certain other broader factors that contribute towards improving quality under public health insurance schemes. The first and foremost is institutional stewardship, which relates to a certain stewardship of instilling a culture of quality across providers, right? Providers are always keen to learn. It's not always about the money for them. It's a Hippocratic oath that they have taken, and what they're looking to do is serve the community. And I personally have seen myself how enthusiastic doctors are as learners. And developing institutions and platforms that can really support this learning, can bring them up to speed on what is the best practice in medicine at this point in time, is important to instituting that culture of quality within the health system. Secondly is the clear establishment of standard treatment guidelines, which are nothing more but benchmarks, right? Of course, we don't expect, nobody expects that doctors are going to do every procedure as per a defined guideline. I think there's so many different patient variables that go into this, and so many different practice variables that go into it. That would be unrealistic. But it is more to say that having the standard treatment guideline establishes a benchmark to which providers can strive in terms of attaining a certain level of quality of care. And finally, I think this goes without saying, health information systems. Our modern society is built on information, on having knowledge, and strategic purchasing is no different, because ultimately, the data in terms of outcomes, is what forms the basis of, provider payment mechanisms, etc. So having a very robust health information system, a very transparent health information system is essential to promoting strategic purchasing. Next slide. Now, there often also tends to be, a certain amount of confusion about what strategic purchasing is. So maybe I'll take a quick minute to just highlight what strategic purchasing is not. Just to say that, this is a science that is fairly recent, not science, it is, a concept that is fairly recent. So there are bound to be certain clarifications that need to be addressed, as strategic purchasing evolves. So just to say that strategic purchasing is not about procurement of drugs and equipments, right? Strategic purchasing very concretely looks to pay for a certain set of outcomes, a certain amount of money for a certain set of outcomes. And that is what it's really about. It's not about buying drugs and equipments. Strategic purchasing is also not just a specific focus on cost containment. I mean, it is not to say that, the aim of strategic purchasing is to make sure that the doctor needs to do this in 100 rupees. It's that if the doctor needs 120 rupees to provide good quality of care, then we will give the doctor or the hospital 120 rupees. And that is what strategic purchasing is, because ultimately it has to work in the interest of both the purchaser and the provider. I mean, it is a collaborative effort. Both parties are working in the interest of the health system. And, the considerations for each party need to be, taken into account. I mean, specifically with private providers, but also with public for that matter. So what strategic purchasing is also not, is just contracting out of services without regard to outcomes. And why strategic purchasing has such an important role to play in quality of care is because it is welded in with ensuring outcomes. And outcomes is, the ultimate measure of quality of care, right? Because if you have good quality of care, one would in most cases assume that you're going to have good outcomes. But having said all that, strategic purchasing is not a silver bullet for improving health outcomes. There are multiple factors, that go in terms of human resource capacity, in terms of availability of even basic infrastructure such as, water sanitation. So while it is an important tool and an input to improve quality of care, it is only one of many. Next, please. So, sorry, could you please go to the previous slide, Dr. Bijoy? Oh, I'm not sure if you have the slides or Mr. Latif does. Thank you. So coming to some country case studies, as I said, it's always important to learn, from other examples as to what can be done. So over here, what we have is a quick overview of the value-based purchasing program from the US. The Department of Health and Human Services and the Center for Medicare and Medicaid Services, which is a purchaser for low-income households and people above the age of 60, have a program called value-based purchasing that pays hospitals for inpatient acute care based on quality of care. This is done through comparing how a hospital fares in comparison to other hospitals based on a given baseline, and also compares it to its own baseline. This is done across 4 domains of safety, clinical outcomes, efficiency, and cost reduction, as well as person and community engagement. On your right, you see certain measures. As you can see, there are some very specific clinical measures such as heart failure, 30-day mortality rate, or for that example, surgical site infections, which all feed into making a decision of what the level of reimbursement that a provider would be given. Next, please. And even in the UK, although this is not specific to public insurance in the way we see it in India in terms of inpatient curative care, but under the NHS in UK, general practitioners also have a performance management system, which is called the Quality Outcomes Framework. Now, this is a voluntary system. It's not about performance management really, but what this system does is rewards good practices. So if you as a GP, along the 4 domains of clinical, public health, and quality improvement can show that you have attained, a certain level of practice or a certain level of standard, then you are, incentivized to maintain that or do more. And this is based on achievement against a 68 detailed list of indicators, and accordingly, reimbursements are adjusted. Next, please. Finally, I know oftentimes you hear about, examples from the US and UK, and one wonders, okay, maybe we should talk about something that may be more relevant to the setting in India. While I think there's always, one should always strive to move further, because I don't think we lack the capacity or the competency to develop systems like that. But even evidence from LMICs, which is low and middle income countries, show that linking payments, to quality, programs that link payment to quality can incentivize providers to do better. And it's not just a question of, doing it for the money, but it's a question of providing them the incentives and resources to further keep enhancing their quality of care in the interest of patients, which is what doctors do. So in conclusion, if you could please go to the next slide. In conclusion, strategic purchasing can play an important role in influencing provider behavior and quality practices, because it, gives them the adequate compensation as well as, some sort of guarantee of reimbursement to provide quality practices. Public insurance schemes such as PMJ have set an important precedent. PMJ does link certain quality measures, as we saw, to provider incentives, which is extremely helpful. However, as mentioned, provider incentives in terms of payments is only one part of it. To further enhance QOC, there are certain benchmarks such as standard treatment guidelines, a certain wealth or a certain breadth of information required. And it's also important to instill a culture of quality to truly affect quality of care under public insurance schemes. Finally, strategic purchasing, to influence QOC requires considerable efforts on multiple levels of system building. Just as medical knowledge builds and changes and grows day to day, strategic purchasing needs to adapt to changing practices and be dynamic in order to address, the issues and problems of the day. So with that, I end my presentation and thank you once again for being here and hearing me. Thank you.
Amazing presentation. Thank you, Mr. Jaydev and Grace. We extend our heartfelt thanks to WHO country office and especially Mr. Dr. Sachin Bukhare who help us to reach out to you. So the floor is now open for a discussion, or the speakers panel will address all the potential queries. So when you are flagging something, please keep in mind all the presented matters will be included in your questions. So the floor is open for queries. All the participants can either raise their hands or put your query in the chat box, or you can unmute and speak. Now all can unmute and speak. The host have facilitated that. I think there is no question from the participant side. Then Vijay sir, can we wind up? Sir, you are mute, sir.
Yeah, if there is no queries from the participant side, I think we can wind up. Right, Pankaj sir, can we?
So, yeah, sure. I'll just like to say the things. Jaydev has really presented a very nice presentation, and it told us that the quality of care is really important, and it is actually. If I go to the hospital, I feel that I should get the quality. The room should be clean, the bed sheet should be clean, and the bathroom should be clean, and the doctor should be up to the mark. The staff should be well dedicated, should take care of the things in a proper, in a formal manner, actually, not like a casual behavior. That's what the final outcome will depend upon: the attitude, the behavior, the dedication, and the things which are provided, the facilities actually. So the ABPMJ is up to the mark in that, and we asked the hospital to give get the certification. We have the bronze, silver, and gold as Jaydev specified, and we also take care of the incentivization which should happen if they have those kind of certification, to boost them to meet the expenses for getting those level of quality, to give the patient who usually even not getting the normal treatment, they will get the quality treatment. So the program is not only focuses in giving the treatment, it also acknowledges the fact that they need a quality treatment. So that the program is, and then I really thank the SHE Kerala to also give us the support and the way they have delivered to get the treatment to all the PMJ beneficiaries. And I will hereby ask again to make more empaneled hospitals available for for the public who can go to that place, more quality hospital to give them care, reach them, make the cards for them, make them know, make them empowered. They should know that they're having this facility. The government is doing something for them. They don't know actually sometimes. So that gap has to be bridged, that they know that the facility is available. They need to get it. We are there to help them. We are there to take their grievances into factor. And also we should empower our hospital providers, that they should also know that we are there for them also. We are there to help them, because if we will not be helping them, they will not be helping the people. So there has to be a win-win situation which should be created between the healthcare provider, the ESCPs, and the beneficiaries, and us being the mediators and the listeners in delivering the best quality healthcare to the public. Thank you. That was my submission.
Thank you, sir. Thank you for your words. Thank you. Latif?
Now I would like to invite my colleague, Dr. Vimal, who is HNQA manager in State Health Agency, Kerala, to deliver the vote of thanks.
Thank you, Latif. A very good evening to all. So it gives me an immense pleasure to deliver the vote of thanks for this event to all the dignitaries assembled here. So first of all, I would start with Dr. Pankaj, sir. Thank you, sir. Thank you for giving a brief outcome about PMJY and for the support from NHA as well in care of quality and environment. Thank you, sir. Then I would like to thank Dr. Grace Madam and Dr. Jaydev Singh sir. Sir, the presentation was very clear about this quality and value-based purchasing. So I am the manager for this specific topic. So thank you for the topic, sir.
Thank you. Thank you so much.
Sir, thank you for all the dignitaries who find time in their busy schedule to present in this occasion. We thank our Executive Director, Dr. Ratan Gelkar IAS, sir, for his valuable contribution, guidance, and encouragement in all our efforts. SHA extends its thanks to all the distinguished invitees present in the online webinar, accepting our invitation. Once again, I thank all for your attention. Thank you. Thanks.
Thank you, sir. Thank you. Thank you very much.
So here we are winding up. Thank you. Thank you once again.
Thank you, sir.
Thank you. And happy Doctors Day to all.
Happy Doctors Day.
Thank you.